Coronary CT scans use a big donut-shaped machine to rotate a narrow X-ray beam around you. The computer gathers the results of that and creates a 2D image of a single slice through your body. The table then moves your body down a bit and repeats the process over and over again, so you now have multiple images of slices of your body. The radiologist evaluating those images and creating that report has special software that uses those 2D images to construct a full 3D image of your heart. This is my heart. This is the left circumflex artery and the obtuse marginal branches coming off of it. This is the aorta. This is the end of the RCA, the right coronary artery. And this large thing here is the end of one of my stents. If we rotate around to the front of the heart, we see the LAD, the left anterior descending artery, also known as the widowmaker. And here's another one of my stents. The left circumflex artery and the left anterior descending artery come together at the left main artery. The radiologist pointed out a little plaque buildup here. I can't really see the difference. Rotate around to see the top end of that right coronary artery, and we can see the start of that long stent. Rotate back around some more, and we can see where that stenting ends up again. Now that's actually 5 stents. 3 stents back to back because they didn't have one long enough to cover the entire distance, which was 84 millimeters or 3.3 inches. And then 2 more stents inserted inside of those stents a year later because the original stents got plugged up with scar tissue. And I was told it's probably because the first set wasn't fully expanded and too narrow to start with. The doctor that inserted the second set inside of the first set made sure to fully expand the second set to help prevent that issue in the future. And I could definitely feel it for a few weeks after the surgery. If you're counting, that's 6 stents total, 3 in the RCA, plus another 2 placed inside of those, plus 1 in the LAD, or widowmaker. The radiologist can also zoom in on individual arteries and look for hard and soft plaque, blockages, and blood flow. As you see in this image of one of my stents, they can even see inside the stents. We refer to these as CCTAs. Coronary, your heart, angiogram is an X-ray photograph, and computed tomography, also known as a CAT scan, is the X-ray imaging technique used to create that 3D model of your heart. So how cool is that? Using a CT scan, you get a complete and total picture of your heart's arterial health. So why wouldn't everyone get this done? Well, a couple reasons. First, it exposes you to a lot of radiation, so you want to limit how often you get this done, which means it's not appropriate as a simple preventative screening. Second, some folks, like me, are allergic to the contrast dye they inject in you to enhance the imagery. Only about 2% of the population has this issue, but for those of us who do, it is miserable. For me, it looks like a really bad sunburn all over my body that lasts for a week to 10 days. I feel like every capillary in my skin is exploding. They can give you antihistamines to minimize the effect, but it's still miserable. And finally, the cost. You're looking at anywhere from maybe $600 to over $1,000. Now, if you want a quick, inexpensive, and safe way to get a read on your arterial health and help you decide if a CCTA is appropriate, consider getting a CIMT. It measures the hard and soft plaque in your carotid artery. That's the one that feeds blood to your brain, so it's kind of important. The CIMT uses the same harmless ultrasound that they use on fetuses in a mother's womb to look inside your arteries. This is one of my carotid arteries, and you can see a little plaque here. The bigger that gets, the more it blocks the blood flow. And the more soft plaque you see, the higher risk you are of having a heart attack or a stroke. And if you see plaque in the carotid artery, then you probably have plaque in your heart and may want to consider getting the CCTA. I have lots of videos walking you through CIMTs if you want to learn more about that. I really don't understand why CCTAs aren't considered a preventative measure like mammograms or colonoscopies. There's no better way to get a complete picture of your heart's health. You can find out years or even decades before you have a heart attack or a stroke if you're at risk, so you can correct it before things get out of control. But there is a way to get an even better review of the imagery. It's called an FFR, or fractional flow reserve. It uses AI to analyze all the stuff we just saw and provides a 3D model showing you the arteries and how much flow or blockage each has and where. We dive into that topic in this video. Have you gotten a CCTA? What was your experience? Hit the like and subscribe buttons, and then leave a comment sharing your experience to help others decide if this is something they would like to pursue. The imaging centers require by law in the U.S. to give you a copy of these images, their written report, and to execute an electronic transfer to the provider of your choice if you ask for it. So definitely ask for all of that. Now, I've never been charged for it, but apparently they can charge a modest fee if they want to, usually $25 to $50.